Hello, so welcome to the Kanski lecture series, and today we are going to start the cornea chapter 8 of the Kanski, and it is the cornea and the refractive surgery. One thing I must say before starting of this chapter is that I feel that it is really it is not enough of the knowledge that is written in this topic. There are much more when we discuss the cornea and the refractive surgery, but for the basic concepts it's enough. So let's get started. So in this part we are going to discuss about the keratoplasty. So what is basically a keratoplasty? A keratoplasty means cornea transplant. Basically, cornea transplant is when you replace a diseased cornea and you put it with the healthy donor cornea is called the corneal transplant. Basically, cornea is a privileged transplant because it has no such blood supply and there are no such immunological factors. So that is why the survival of the graft is more likely than in any kind of graft. So let's get started. Keratoplasty. Introduction. Corneal transplantation. Grafting referred to the replacement of the diseased host corneal tissue by the healthy donor cornea. A corneal graft keratoplasty may be partial thickness, anterior or posterior lamellar, or full thickness penetrating. So let's discuss about the types of the keratoplasty. So there are different types of keratoplasty. That is full, like you replace the full cornea with a donor cornea, then that is called the penetrating keratoplasty or PKP. And when you replace a layer of a cornea with a donor cornea, then it is called the lamellar keratoplasty, and it can be superficial or it can be deep as well, and it can be interior and it can be posterior. So what are the general indications of the keratoplasty? So keratoplasty, basically there are four indications for the keratoplasty. One is not very common. The most common is the optical, when you have to increase the refractive power of the eye and you clear the refractive area of the cornea. It's the most important indication. Next is the tectonic, for the tectonic purpose to maintain the integrity of the eyeball, then it is called the tectonic keratoplasty. And third is therapeutic. Therapeutic means when you replace a diseased cornea, like if the cornea is infected with some kind of bacteria or infection or some kind of fungi and you are unable to get rid of the infection with the topical treatment, then you may do keratoplasty. You remove all the diseased cornea with infection and replace it with the healthy cornea. It is another indication for the keratoplasty. And other very less common is for the purpose of the cosmetic. General indications. Optical keratoplasty is performed to improve vision. Important indication include keratoconus, scarring, corneal dystrophies, pseudophakic bullous keratopathy, and corneal degenerations. Tectonic grafting may be carried out to restore or preserve the corneal integrity in eyes with severe structural damage such as thinning with desmatocele, US spelling desmatocele. Therapeutic corneal transplantation facilitate removal of infected corneal tissue in eye unresponsive to the antimicrobial therapy. Cosmetic grafting may be performed to improve the appearance of the eye but is a rare indication. So you can see the figure 8.1. You can see A is an optical penetrating keratoplasty for the macular corneal dystrophy. So you see the clear area of the cornea, and C is showing tectonic lamellar patch graft for desmatocele, and third is a penetrating keratoplasty for pseudomonas keratitis, means the cornea was infected previously with the pseudomonas and now it is replaced by the cornea. A dense cataract and posterior synechies are visible. Next is a donor tissue. So you have to look for certain things in the donor tissue to think that it is an appropriate tissue for the transplantation. So first, it is very important when to harvest the donor tissue, because of course you cannot harvest the donor tissue in a live person, but you can harvest the person from the patient in when he died. And also, what condition caused the death of the death of the person, and is there the cornea is healthy, its endothelium, its other it was the cornea diseased of the donor tissue. So you these are very important factors to for the donation of the cornea. Tissue should be removed within 12 to 24 hours of death. There is an attempt of to age match donor and recipient. Cornea from infant 3 year and under are used only very occasionally, even for pediatric transplant, as they are associated with surgical refractive and rejection problem. Most cornea are stored in a coordinating eye banks prior to transplantation, where pre-release evaluation include medical history review and a donor blood screening to exclude contraindications, and microscopic examination of the cornea, including endothelial cell count determined. So basically, you we do not use the cornea of a 3 years or underage, because the cornea is not so developed, and it is basically elastic cornea and a little bit of smaller. So that is why we do not use the cornea of the pediatric transplants. Next is that there are certain eye banks that harvest the cornea, and then they look for the evaluation of the cornea. Cornea are preserved in a hypothermic storage up to 7 to 10 days, or in organ culture media 4 weeks until needed. Culture allows extending testing for infective contamination. Contraindication to ocular tissue donation are set out below, though there is international variation and the list is not exhaustive. So there's certain storage materials that can be used to store the cornea. And there are hypothermic, means at lower temperature, usually at -4 degrees Celsius, for up to 7 to 10 days. And you can also preserve it in the organ culture media for 4 weeks. Death from so what are the contraindications for the donor for donating the cornea? That is the death from unknown cause, certain systemic infections such as human immunodeficiency virus, viral hepatitis, syphilis, congenital rubella, tuberculosis, septicemia, and active malaria. So these are all the contraindications of the donation of cornea. Prior high risk behavior for HIV and hepatitis, such as sex with someone HIV positive, men who have sex with men, intravenous drug abuse, and prostitution. So high risk behaviors are also the contraindication for the donor cornea. Within the last 12 months, sex with someone who has engaged in high risk behavior, who has received blood clotting factor concentrate, or has undergone tattooing, acupuncture, ear and body piercing. Infectious and a possible infectious disease of the central nervous system, such as Creutzfeldt-Jakob disease, systemic sclerosis, panencephalitis, progressive multifocal leukoencephalopathy and encephalitis, Alzheimer's disease and other dementias, Parkinson disease, multiple sclerosis, and motor neuron disease. So these are the CNS diseases that are usually contraindicated to the corneal donations. Next is receipt of the transplanted organ. So if the donor person is already donated, having some kind of organ donation, then it is contraindication. Receipt of the immune pituitary derived growth hormone, brain or spinal surgery before 1992, most hematological malignancy, ocular disease such as inflammation and disease likely to compromise graft outcome, some malignant ocular tumor, for example retinoblastoma, and corneal refractive surgery. So very important, if the patient has undergone the corneal refractive surgery, then it is a contraindication to the donation of the graft. Recipient prognostic factor. So that was the donor cornea where it is contraindicated not to donate the cornea. So what are the factors in the recipient which make the chances of the graft survival more likely or less likely? So if the cornea is usually having some kind of disease like glaucoma or having a uveitis, it is most likely to getting the failure of the graft. And also if there is a very stromal vascularization or cornea vascularization, it is going to be the failure of the graft. The following host factors may adversely affect the prognosis of the corneal graft and, if possible, should be optimized prior to surgery. In general, the most favorable cases are keratoconus and localized scar and dystrophy. So, what are the most important indication of corneal transplant? It is the keratoconus. Severe stromal vascularization, figure 8.2, absence of corneal sensation, extreme thinning of the proposed host graft junction, and active corneal inflammation. Abnormalities of the eyelid such as blepharitis, ectropion, entropion, and trichiasis. These conditions should be addressed before surgery. Recurrent or progressive form of conjunctival inflammation such as atopic conjunctivitis and ocular cicatricial pemphigoid, tear film dysfunctions, anterior synecdoche, uncontrolled glaucoma, and uveitis. So these are all the things that can make the chances of the graft survival less likely. And you have to improve all the eyelid condition before the corneal transplant, and you have to treat any inflammation before the transplant. So that's it for the cornea refractive surgery part 1. See you in the next lecture.